use of heat to cure illness, including cancer, has a long history. In approximately 500 BCE, Greek philosopher Parmenides said, "Give me the power to produce fever, and I'll cure all disease." This sentiment was echoed by the father of Western medicine, Hippocrates, who treated breast tumors, apparently with success, with heat. In this video, we explore the use of heat during cancer treatment, one of the most gentle, synergistic treatments there is. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. History. The first academic paper on hyperthermia and cancer was published in 1866. It described a 43-year-old woman with an advanced tumor on her face. She developed a fever, which led to the tumor's regression. The effects of fever on tumor regression were studied exhaustively by Dr. William Coley. Deeply affected by the death of one of his first patients, Coley combed through the files of Memorial Hospital, now Memorial Sloan Kettering, for cases of spontaneous remission. He came across the file of Fred Stein, who had an inoperable tumor on his neck that spontaneously regressed. Upon meeting Stein, Coley became convinced that an infection Stein had recovered from was the key factor in his remission. In 1893, Coley developed a vaccine of fever-inducing toxins from dead bacteria and began administering them to patients with terminal cancer. His retrospective analysis found that in 312 inoperable patients, 5-year survival was 43% and 61% amongst 172 patients whose cancer was resectable. Additionally, the higher the patient's temperature, the greater their chances for remission. Coley's discovery was concurrent with the advent of X-rays and brachytherapy, the insertion of a radiation source into the body. Coley's vaccine was presented in the medical community as in competition with these two new therapies and suffered a damaged reputation as a result. One of the most powerful critics of Coley's vaccine and proponent of X-rays was James Ewing, famed surgeon for whom Ewing's sarcoma is named. Ewing was at the head of surgery at Memorial Hospital and essentially Coley's boss. Coley's toxins puttered around in near obscurity despite having moderate success in a 7-year-long clinical trial in 1962, the very year before they were deemed an investigational drug and made illegal to prescribe outside of a clinical trial by the FDA. In 2007, the intellectual property to Coley's vaccine was purchased by Pfizer. Despite proclamations of interest in developing the vaccine for clinical use, there has been no further news of development. Soon, scientists began studying external applications of heat during cancer treatment. In 1898, inoperable cervical cancers were treated by water heated to 108 to 111 degrees Fahrenheit. Tumor regression was observed in all 7 patients treated, including a complete response in 1. However, due to the pain it caused and the long treatment times, this method was abandoned. In 1916, local hyperthermia was used to cure inoperable uterine cancer, a result which was then confirmed in later experiments. In 1932, hyperthermia in the form of hot baths was used to successfully treat penile cancer. By 1912, researchers had already combined hyperthermia and radiation and achieved impressive results. A trial of 100 patients showed that combined hyperthermia and radiation eradicated tumors in 1/3 of cases and led to a partial response in 1/3 more. Nowadays, hyperthermia is primarily used as a complement to other treatments such as chemotherapy or radiation, rather than on its own. Mechanism of action. Hyperthermia has several mechanisms of action against cancer. Its primary mechanism is through its effect on the abundant and chaotic tumor vasculature. Hyperthermia can lead to vascular dilation and increased oxygenation of tumors. Oxygenation of tumors is good. At temperatures above 104 degrees Fahrenheit, the tumor vasculature is directly damaged. High temperatures also increase cancer membrane permeability, allowing more cytotoxic treatment to enter. Hyperthermia has been shown to increase blood flow inside breast tumors 350%, allowing more therapeutic agents inside the tumor 350%, allowing more therapeutic agents inside the tumor. Changes in the membrane structure can also decrease metastatic potential. Lastly, mild hyperthermia has been shown to be immune stimulating, with over 80% of patients treated showing increased CD8+ immune cells 24 hours after treatment. Human evidence. The human evidence for the efficacy of hyperthermia in conjunction with other cancer treatments is overwhelming. A review of 38 trials involving breast, cervical, rectal, head and neck, lung, bladder, esophageal, skin cancer patient found reported a complete response of 39.8% of patients treated with radiation alone, and a 54.9% complete response rate of patients treated with hyperthermia concurrent with radiation. A review of 14 studies involving 395 patients with advanced pancreatic cancer found that hyperthermia concurrent with radiation and/or chemotherapy led to a median survival of 11.7 months versus 5.6 months without hyperthermia. Overall response rate was also better when hyperthermia was added, 43.9% versus 35.3%. A Phase 3 clinical trial with 56 head and neck cancer patients were randomly assigned to either receive radiation therapy or radiation with regional hyperthermia. The complete response rate of the radiation alone group was 42% compared to 79% in the combination group. The hyperthermia group showed no additional toxicity. Far more human trials are summarized in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. The following chart summarizes the response rate when adding hyperthermia to radiation and/or chemotherapy in different cancers. The time when hyperthermia is applied relative to radiation matters. One trial with cervical cancer patients examined the effect that hyperthermia had 1 to 4 hours after radiation. The group that had their hyperthermia administered 79 minutes or less after radiation had a 5-year survival rate of 52%, while the group that had their hyperthermia administered more than 79 minutes after radiation had a 5-year survival of 17%. There was no significant difference in toxicity between the two groups. The studies coming out of Chemothermia Oncology Center also only use gaps of about an hour between different treatment modalities. Hyperthermia is most widely used outside of the United States, primarily in Europe and Japan, and is even part of the standard of care in some countries. Hyperthermia has been reimbursable by insurance in Japan since 1985. Although it is possible to get hyperthermia covered by insurance in select instances in the United States, the reimbursement rates are low, which has inhibited adoption. According to Peter Corey, PhD of the University of Arkansas, if the reimbursement issues could be resolved, most of the rest of the roadblocks would follow suit. Most hyperthermia centers would typically use high-powered machines to administer local or regional hyperthermia. Whole-body hyperthermia can be achieved by people at home using a personal infrared sauna or even a very hot bath. Despite its ease of use, affordability, and accessibility, whole-body hyperthermia can be quite effective. 12 refractory sarcoma patients were treated with whole-body hyperthermia concurrent with chemotherapy. 7 patients had a partial response, and 3 had stable disease. Considering all patients had been refractory, the improvement in responses is due to the whole-body hyperthermia. In another study with refractory ovarian cancer patients, the addition of hyperthermia to chemotherapy produced a complete response rate of 6%, a partial response rate of 24%, and a stable disease rate of 24% for a disease control rate of 54%. Again, since these patients were refractory, the improvement is due to whole-body hyperthermia. Whole-body hyperthermia used before surgery has even been shown to improve outcomes. In whole-body hyperthermia, the temperature of 103 degrees Fahrenheit for a longer period is expected to achieve a greater therapeutic result than a higher temperature for a shorter amount of time. For more information about hyperthermia and treatment centers, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.